Welcome to Flip Your Script, the vodcast from the American College of Lifestyle Medicine that is all about clinicians redefining care through lifestyle medicine. My name is Dr. Padmaja Patel, and I'm the current president of the American College of Lifestyle Medicine. I'm board certified in internal medicine and lifestyle medicine, and currently serve as the Chief Medical Officer of HonorHealth. Each episode delivers 5 key takeaways from leading experts, innovators, and practitioners on how lifestyle medicine is reshaping the future of healthcare through practical strategies and real-world success stories. We empower you to make a lasting impact in your organization and beyond. In this episode, we are honored to be joined by Todd LaPorte. Todd is the CEO at HonorHealth, leading an integrated health system with 10 acute care hospitals and 2 specialty hospitals, rehab and behavioral health, in addition to outpatient facilities, a research institute, and community programs addressing social determinants of health and military preparedness. He joined HonorHealth in 2001, serving nearly 2 decades as its chief financial officer before becoming CEO in 2017. HonorHealth has invested in an ACO for a decade in order to make community impact more proactive. HonorHealth is a founding member of ACLM's Innovators Council, a national collaborative uniting health systems, payers, and employers committed to embedding root cause whole person care into the fabric of healthcare. As part of this partnership, HonorHealth has made a significant investment in training and certifying its clinical teams in evidence-based lifestyle medicine. Their leadership is advancing the integration of lifestyle medicine principles into system-wide strategy and care delivery, with a clear focus on enhancing employee well-being and improving community health outcomes. Welcome, Todd. I'm so excited for our conversation today. It's great to have you join us. How are you doing?
Oh, it's just great to be here. And of course, every day looks like my background, right? So how can you not be in a good mood? Padmaja, I am just so excited about the light that you're shining on this movement and this new way of thinking about healthcare. So I'm ready to get started. Let's share our story with everybody.
Thank you so much. Yeah, so to kick things off, I would love to hear what initiatives is HonorHealth currently championing in the space of lifestyle medicine and integrative health?
So we have several things going on. One is we started about 3 years ago a community project in collaboration with Blue Zones. We call it the Blue Zones Scottsdale Community Project. And frankly, its impact is going to be even much broader than Scottsdale. We actually serve the greater Phoenix metropolitan area, but we had stakeholders in Scottsdale proper that were ready, if you will, to embrace and rally around a very defined community project in a municipality like Scottsdale. So that is one of the things that we're doing. It's about a 5-year certification process where does our city and its stakeholders engage in things that are that lead us to the practices that were studied by Blue Zones by communities that really have very good track records of health, with lots of centenarians. People just live longer and live better. So we have a community project. We also have, we've also submitted HonorHealth with our 17,000 employees. We've submitted to a worksite certification process, which runs concurrently then with the community project. And it's lots of different tactics. It ranges from, our practices in our cafeterias. We look at our facility landscape and amenities, and are they conducive to things that sort of promote natural movement? There are things that we've done to host purpose workshops for our employees, create opportunities for fellowship, things like walking MOIs. We do that inside HonorHealth, and we do it community-wide. So those are two things that are in collaboration with Blue Zones. We're also launching next spring an Integrative Health and Lifestyle Medicine Institute under the
Yeah.
leadership and vision of Dr. Shad Marvasti. It's very exciting.
Hmm.
This will be in a facility that's going to be dedicated to sports and wellness, and it'll have some of your typical, if you will, clinical services, but it will also then have elements of promoting integrative health, things like acupuncture, yoga, teaching kitchens, etc. And so we're very excited about how that'll be kind of synergistic, if you will, with clinical care. And then maybe lastly, the thing I'd point out is we have been very aggressive about expanding our primary care footprint. We might be the largest employer of primary care in Phoenix Metro.
Wow.
And then even recently, we just announced 2 weeks ago acquisition of Cigna's primary care practices in Phoenix, about 18 sites with
Wow.
about 70 primary care physicians and APPs. And they'll be integrated come January 1st. They'll be integrated into our already pretty substantial primary care footprint. And we view that as sort of a very front door of relationship with the community. And it presents an opportunity now that we can, again, with some of these clinicians that you just indicated being trained in lifestyle medicine, that they'll be able to incorporate that into actual clinical practice. And so we see this all of this we see as what has been coined convergence, right?
Yes.
It's rallying community efforts with our own sort of work or employer efforts, along with now even our own primary care efforts. So it's really an exciting time.
Yes, I love that convergence, community, clinical, as well as your personal, own employee health, integrating all of that, and the vision you have. Truly, I think you're a trailblazing leader. Really, I can't wait to see how all of these unfold over the years. But could you please share what sparked this direction, not only from an organizational standpoint, but also for you personally as a leader?
Padmaja, it is deeply personal for me. Just a little over 10 years ago, I had a heart attack, which was way too young. I was 52 at the time. And, I look back on it. It's not surprising that it happened when I look at my lifestyle and all the elements of it. But it became an awakening. There was a moment in the hospital room. I have 4 daughters. They were all gathered around me, along with my wife. And one of the daughters says, "All right, Dad, from now on, we're going to make sure you do this, this, and this." And then another daughter looks at the eldest daughter and says, "Get off of Dad's back. Can't you tell he just had a heart attack?" Then another daughter says, "Hey, she's just trying to help. Get off of her back." And then my youngest daughter, who is so poignant, I'll always remember, just by my right side at the hospital bed, starts crying.
Oh.
And she says, "Dad, I'm scared." And it was a moment where I realized that I had so overdone the concept of servant leadership that I had forgotten to engage in self-care. And so that awakening, as I refer to it, really pointed me in a new direction to think about what is it I have to do to truly be healthy. And so from that awakening, I discovered Blue Zones.
Wow.
And it resonated with me. The principles that they espoused resonated with me. And I did some reading of some other things. And it just all the dots were starting to connect that I could control this. I could be a part of this. And so that's what led me to Blue Zones, and in a larger way, this whole notion of whole health, and then even converging clinical with a community culture and community amenities, and how to make the environment, if you will,
Yes.
more, making it easier for people to make healthy choices.
Right.
So that was the personal journey. Then, as an organization, like many in our industry, right, we've tipped our toes into the water of value-based contracting, right? It's like, okay, how do we take responsibility for a population, kind of a population health mentality, and say, how do we engage with a population in a way in which we more proactively try to help influence health rather than the traditional approach where it was just wait for people to present for care when they had an acute condition. And I would just say we were, traditionally involved in sick care as opposed to more involved with well care. Now, that was tricky, right? Because that meant being involved more in a front end,
Yes.
engaging in a whole new way. And also that after we would discharge patients from our hospital settings, how did we stay in touch with them? How did we stay connected? How did we help them in their post-discharge environment?
Mm.
So, and it made sense to do that when, in effect, you were in contracts that placed you at risk for healthcare utilization.
That's good.
So it was practical, but it was also, frankly, our mission. And our mission statement was to improve the health and well-being of those we serve. Well, that meant, engaging a bit more than just waiting for people to present for care when they were, had gotten to an acute state and were vulnerable. Hey, we're going to do that and we're going to be expert at it. But you know what? We need to widen our peripheral vision here in terms of how we engage with patients in the community.
Yeah, yeah, very well said. I think everyone would want to probably understand how does this body of work aligns with HonorHealth's broader mission and enterprise today. Most health system, I would say, are still quite concerned about, fee-for-service revenue going down if you're improving overall population health. What is your take on that?
So a couple takes. One is that, first of all, I will admit we serve an urban area that is, I think this county, Maricopa County in Phoenix Metro, is the fastest growing county in the country. And it's typically in the top 5 year after year.
Hmm.
So we're growing. So as a result of that, I don't worry that there won't be backfill if we actually do bend the utilization curve. If we
Mhm.
actually keep people out of hospitals, if we actually help them be well, I know there's going to be a backfill of plenty of more demand, if you will, that's going to be
Mhm.
utilizing our footprint. So, admittedly, when you're in an environment like that, it gives you a bit more courage to quote unquote just sort of do the right thing. And I'd never lose sight of the fact that's our mission. Um, but the other thing is that I don't think a lot of my peers necessarily think about that we're already in a reimbursement system
Mhm.
that is not adequately reimbursing us for a growingly acute, chronically ill population.
Mhm.
It's not keeping up with what the demands are when we're treating people, quote unquote, on the back end for sick care.
That's true.
So, somewhat defensively, I think we all need to be engaged with this thinking, or it's just a tsunami of very acute demand that's going to come at us in a reward system that doesn't properly recognizes the resources we have to exhaust to serve it.
Hmm. Yes. Yes, and I mean, we can all expect that hopefully the incentives will be aligned in terms of we will be hopefully getting paid for doing the right work, right? Improving health, putting chronic disease into remission. And I am optimistic. I think we will see those payment models eventually come down. But in what ways does this work connect to workforce development and well-being of your employees? Could you please share a little bit about your work in these areas?
Well, it's interesting because when I first did my due diligence, for example, on Blue Zones, I spoke with Barclay Burdans, who's the CEO of Texas Health Resources. They were really the first major urban area in Fort Worth
Mm-hmm.
that took on a community project. I want to say 6, 7 years before we did. And I said, Barkley, how does this pencil out? How did you see value? And he said,
Mm-hmm.
Todd, it's really hard to quantify. You can, but it's hard to quantify. And he said, really, what's been so obvious to me now is it reframed how the community looked at us as a trusted advisor, as Texas Health Resources, as um, an institution that people could place their trust in for their health. And he said, how do you put a value on that exactly, right? Well, I would tell you an unintended but very important consequence of our, going down this journey of all the things I shared with you earlier is that our workforce has been so energized and excited about it. They like being associated with the message that comes with our sort of being this type of facilitator and leader in the community.
Mm-hmm.
And they've appreciated that our organization has basically said, we care about your health as
Yeah.
well, not
Yeah.
just the community. And so as we've gone through our worksite certification process, right, people have seen we've been making investments in those things that, we believe promote their good health. And so, as we all know, the biggest challenge in healthcare is that there's a supply and demand problem. Supply of caregivers is not adequate in relationship to the demand of the rising acute care. So, our, really addressing the whole health, the
Mm-hmm.
whole person of each employee, I think differentiates us as we're competing for talent. And so, first of all, it's the right thing to do. But second of all, I think it becomes also a competitive differentiation that everyone should consider. And I think our employees have really appreciated, our team members have really appreciated that we've gone that extra mile in this way.
Yeah, and that definitely boosts our morale. And so great, great. Now, looking ahead, how will you define success in this area? And what measures will you use to track meaningful impact?
Well, what's really nice about the collaboration with Blue Zones is they want to be very evidence-based, right? And
Mhm.
metric based. So we have measured many community metrics, kinds of things that I think many of my peers try to address when they do community needs assessments, right?
Right.
And that they call out all kinds of things, right? Smoking rates in their community, you know, uh,
Well-being index. Yeah.
yes, diabetes rates, prenatal care, all these different dimensions. So there are very tangible quality outcomes metrics that we can measure as a community. And so obviously what we'd like to do is over a, half decade to decade, like to see that our efforts are making an impact on those. And
Hmm.
it's really early for us. This isn't one of those things that you're going to snap your finger and see immediately. We're really just now winding up what will be a second year of full deployment, if you will, of our community tactics. But after our first year, what we learned was that, first of all, the awareness of blue zones and the principles had greatly increased. So I guess I would characterize year one was really about raising awareness.
Yes.
And year two is where I think we're starting to see some signs of making an impact on the issue of isolation. And
Mm.
isolation is an interesting metric in a community. What's interesting about it is, Scottsdale, I know a lot of people think it's a fairly elite community, but it really is diverse. There are folks across all parts of the socioeconomic spectrum, but isolation is impacting every one of those demographic groups.
Yeah.
It's being felt by those in a more indigent status. It's being felt by those in even an elite status. And so that's one of the things we saw after a year, awareness of, how to engage in fellowship activities, like the moais, the walking moais that I described, where people just go for walks together. I actually host a walk every 2 weeks on Saturday mornings with my neighbors.
Nice.
And I take them for about a 45-minute walk through the neighborhood. And we talk and we get to know each other better and we get some good exercise.
Oh.
The other thing is that, another really cool thing to address isolation and fellowship is we've launched in partnership with Blue Zones, a volunteer zone. So there's a little app that members of the Scottsdale community can access where nonprofit institutions in our community have said, I need volunteer help for X, Y, and Z. And then individuals in the community can, it's almost like a dating service.
Yes.
These are my interests and these are my skills, and they can be matched up to a volunteer opportunity. And it's win-win, right?
Yes.
So I think how we're going to measure success is, are we making an impact on these different metrics? But it's even that informal way you can just see an energy and a vibrancy occurring in your community where those kinds of activities are happening all around us. And then, there's now, I think I saw that we just had our 5th school that got Blue Zone certified. We have several restaurants in the community that are Blue Zone certified. Well, what does that mean? Well, it might mean, do you make it easier for people to understand good, healthy choices that are on your menu? And do you engage in tactics that help people with things like, you know what, you're going to get fruit with your hamburger. If you want French fries, you can ask for them, but we're going to default and start with fruit as, the normal.
Yeah.
So there's all kinds of things where we'll measure by the level of engagement through folks who commit to, and we even get pledges from the general community. What percentage of our community, its residents, make a pledge to abide by the principles that are being espoused through what's called the Power 9 of Blue Zones?
Yes. Yes. Great. Before we end, I wanted to ask you any closing remarks, especially for our health systems council. We have about 120 health systems that have partnered with ACLM. And what message would you have to encourage other health systems to really sort of dive deeper on some of these lifestyle medicine integration models that you just described?
I guess what I would say is that it is a little scary because we're not certain about how we're going to be rewarded for thinking this way. But I think we've all heard a message loud and clear based on federal funding reform just this past year that there is a cry out that something has to change, and that the current healthcare system is not, it appears as though it's costing more per capita in our country and not necessarily getting the results. And so I would say that we're being spotlighted, that how do we become more a part of the solution as opposed to sort of being blamed for what doesn't appear to be working. And so I want to reframe all of this to where I actually think it's not going to get better unless we're a part of that effort as healthcare systems, because so many people might only lean in if they're hearing from trained professionals experts that this is a right way to approach things. And so I just don't think it's one of those things that I think if we sit back passively, I think we'll get blamed for things that maybe aren't even our fault.
Yes. Well, thank you. Thank you for the message. Thank you for your trailblazing leadership. Well, we're out of time today. I appreciate your time and sharing, especially your vision, expertise, and passion with us. It's been a true pleasure having you join us today on the show. And thank you to our audience for tuning into this episode of Flip Your Script. We hope today's conversation has inspired you with practical insights on how lifestyle medicine is shaping the future of patient care. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring healthcare leaders and clinicians who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.
Good health, everyone.